Eyes for Allah, nothing but Allah. Ba is the beginning of Bismillah. Ta is for taqwa, bewaring of Allah. And Tha is for thawab, a reward. Ja is for Jannah, the garden of paradise. Ha is for Hajj, the blessed pilgrimage. Kha is for Khatem, the seal of the prophethood given to the Prophet Muhammad sallallahu alayhi wasallam. Da is for Deen, Al-Islam, religion with Allah since time began. That is for dhikr, remembering Allah, and rise for the month of Ramadan.
Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala Rasulillahi amma ba'd. You are welcome to your program, Path to Paradise, packaged and powered by Zakat and Sadaqat Foundation. A very good morning to all our viewers and our listeners watching us from the different parts of the world. From the current data churned out by World Health Organization, it indicates that approximately 4.5 billion people all over the world lack access to essential health services. And more concerning to us here in Nigeria, in Lagos State in particular, is the case of millions of Nigerians, particularly the poorest households and people suffering from chronic illnesses, who are unable to access and afford quality healthcare services, not because they do not want to, but because of the harsh economic realities of our time. And it is in this light that your organization, Zakat and Sadaqat Foundation, has taken it upon itself to complement the efforts of the local government, the state government, as well as the federal government in bringing quality health services to the doorsteps of the poorest of the poor. This is going to be the focus of our conversation this morning, looking at medical support in, with regards to caring for life and dignity, and then looking at the inside perspective of Zsf'S medical support initiative. We are going to also be having with us in the house somebody that is a well-known figure, but I will keep that to my chest. When we go on our first break, when we are back, we shall unfold who the special guest is this morning. So please stay tuned as we welcome our sponsor, Haji Mabrur Ventures Limited, to give us their package this morning. Stay back. We shall be back after this time out.
Of Ramadan.
Emeritus Alaji. Assalamu alaikum. Wa alaikum salam, my brother. Haji, assalamu alaikum.
Wa alaikum salam, sir.
If I'm right, it's close to 20 years you've been performing Hajj and Umrah with Haji Mabrur Ventures. What's so special about Haji Mabrur Ventures? MashaAllah, Haji Mabrur Ventures has been impacting Hajj operation for the past 25 years. They are trustworthy with top-notch service delivery. They serve their Hujjaj 2 sumptuous meals daily. Home away from home experience. We are accommodated in exquisite hotels close to Haram with Zihara to only sites at no cost.
Alaji, we can't wait. Please have our passports.
Visit Haji Mabrur Ventures today at number 9A Abiodun Fashakin Crescent behind Old Lasu Campus, Idiroko Bus Stop, Anthony Village, Lagos. Telephone 0809-211-3680 or 0813-790-0777. Abuja Fana Business Suit Complex Limited, Suit B42, Yahusa Suya Sport, 7 Busum Close, behind AP Plaza off Ademola Adetokubo Crescent, Wusetu FCT Abuja. Telephone 0813-381-8891. Haji Mabrur Ventures. Experience, professionalism, and piety.
Emeritus Alaji. Assalamu alaikum. Wa alaikum salam, my brother.
Haji, assalamu alaikum.
Walaikum salam, sir.
If I'm right, it's close to 20 years you've been performing Hajj and Umrah with Hajj Mabrur Ventures. What's so special about Hajj Mabrur Ventures?
MashaAllah. Haji Mabrur Ventures has been impacting Hajj operation for the past 25 years. They are trustworthy with top-notch service delivery. They serve their Hujjaj 2 sumptuous meals daily. Home away from home experience. We are accommodated in exquisite hotels close to Haram with Zihara to holy sites at no cost.
Alaji, we can't wait. Please have our passports.
Visit Haji Mabrur Ventures today at number 9A Abiodun Fashakin Crescent behind Old Lasu Campus, Idiroko Bus Stop, Anthony Village, Lagos. Telephone 0809-211-3680 or 0813-790-0777. Abuja Fana Business Suit Complex Limited, Suite B42, Yahusa Suya Sport, 7 Busum Close, behind AP Plaza off Ademola Adetokunbo Crescent, Wusetu FCT Abuja. Telephone 0813-381-8891. Haji Mabrur Ventures. Experience, professionalism, and piety.
of Ramadan.
Alhamdulillah Rabbil Alameen. You are welcome back. If you are just joining us, you are watching your program, Path to Paradise, packaged and powered by Zakat and Sadaqat Foundation. Like I did mention at the beginning of the program, this morning we shall be looking at another most important thematic area of intervention on the part of Zakat and Sadaqat Foundation, and that is the area of health services or medical support. We are going to be looking at how your organization, Zakat and Sadaqat Foundation, is able to provide qualitative access to medical health services for the less privileged among us, particularly the vulnerables, the elderly ones, the aged, and the poor of the poorest among us. But before we go into the details, I would like you to join us to watch our field operation reports of the medical intervention Zsf'S was able to carry out recently. Please stay tuned. We shall be back after this time out.
Of Ramadan.
For many vulnerable Nigerians, access to quality healthcare remains a distant dream. But for some, hope came through timely intervention. Husseinat Hajara, a petty trader in Abeokuta, Ogun State, battled fibroid in 2020. With limited income, the life-threatening condition became a burden she could not bear. Her story, however, took a turn when the Zakat and Sadaqat Foundation stepped in, covering the full cost of her surgery.
Orúkọ mi ni Hussein Ajarat. Mo jẹ́ kan nínú àwọn tí Ọlọ́run kádàrá kó rí ìrànlọ́wọ́ gbà nínú Zakat and Sadaqat Foundation ọdún yìí. Mo ní ìpèníjà fibroid tí kò sí agbára láti ṣiṣẹ́ abẹ yẹn, ìgbà tí mo wá sí Zakat and Sadaqat Foundation, Ọlọ́run kádàrá pé kí n rí àánú gbà ńbẹ̀. Mo pọ̀ lára àwọn tí wọ́n fún ní ẹ̀gbọ́n tó jẹ́ pé gbogbo owó tí mo fẹ́ fi ṣiṣẹ́ abẹ yẹn pátápátá àwọn ni wọ́n gbé gbogbo. Kódà hospital gan ni mo wà báyìí tí wọ́n ti fẹ́ ṣe iṣẹ́ abẹ yẹn. So mo gbàdúrà pé kọ́lọ́run tí ló máa bá wa kún ìlàlẹ́ àwọn inshallah wàrà fáànà ọmọ kaná adìyẹ.
For Jamal Jimo, a teenager, a simple act of kindness changed his life forever. While helping his neighbor's children to school, he was involved in a motor accident that led to the loss of his right leg. In the face of rising medical bills, the Zakat and Sadaqat Foundation intervened, paying 75% of the cost needed to save his life.
Àjọ Zakat and Sadaqat Foundation wọ́n ní kí a fún ẹ ní 200,000 naira láti fi support iṣẹ́ abẹ tí wọ́n ṣe fún ẹ àti ìtọ́tún fẹ́ ṣe kọ́lọ́n kó ràn ẹ́ lọ́wọ́.
Ọlọ́run á tún máa dá iṣẹ́ wọn kó yọrí sí gbọ̀ngàn.
Pé wọ́n ṣe gan-an ni.
pé wọ́n ṣe gan-an.
ẹ ṣe gidi gan.
Àwọn ọmọ tí wọ́n náà rà láàrin.
Àmín o.
In May 2025, tragedy struck Mokwa in Niger State as a devastating flood claimed over 500 lives and displaced about 5,000 people. Amid the crisis, children, women, the elderly, and persons with disabilities were left in urgent need of medical care. In response, the Zakat and Sadaqat Foundation, in collaboration with its international partner, Human Appeal, provided one of the largest medical support interventions across 2 internally displaced persons camps. From individual interventions to large-scale humanitarian response, the Zakat and Sadaqat Foundation continues to restore hope and save lives across communities.
of Ramadan.
You are welcome back. If you are just joining us, you are watching your program, Path to Paradise, and we are discussing this morning medical support, caring for life and dignity. Joining us this morning in the studio live is the Executive Director and Chief Executive Officer of Zakat and Sadaqat Foundation, Prince Sulaiman Olagunju, who is going to be shedding more light on the medical intervention carried out by Zakat and Sadaqat Foundation. Abala tí a dé náà ni abala tí a ti máa ń fi omi jomi tó ọ̀rọ̀ pẹ̀lú àwọn àlejò wa pàtàkì nílé agodo. Wọ́n ń bẹ pẹ̀lú wa ní òwúrọ̀ yìí, olùdarí àgbà àti ọ̀gá pátápátá ní ìgbìmọ̀ Zakat and Sadaqat tá ń pè ní Zakat and Sadaqat Foundation, ọmọọba Sulaiman Olagunju. Wọ́n bá wa tan ìmọ́lẹ̀ sí ọ̀pọ̀lọpọ̀ àwọn ìgbìyànjú àti àánú tí wọ́n ṣe fáwọn tí wọ́n ní ìpèníjà ìlera. Salamu alaikum warahmatullahi wabarakatuh. Prince.
Wa alaikum salam warahmatullahi wabarakatuh.
It's good having you this morning.
Alhamdulillah, I'm so happy also to be here.
So we would like you, from the field operation we have just seen, we've seen some interventions carried out by ZSF. We want you to please shed more light on what is the vision and then the driving force behind this medical support that ZSF has just carried out.
Thank you so much. The vision of Zakat and Sadaqat Foundation when it comes to health issue is a healthy person is a wealthy person.
Inshallah.
So we strongly believe that a healthy nation is a wealthy nation. And when we have a community that is healthy, it's also a wealthy community.
Inshallah.
And that's why what we try to do is actually to ensure people don't fall into sickness. We provide every effort to ensure that the well-being of human beings are well taken care of. You know, those who are old usually have that challenges. There are some common illness with old age, which with quick support, quick intervention, we can be able to reduce it to the barest minimum. So we prefer prevention than saying curing. So that's our focus, to ensure that before this happens, let's see what we can do. And that's why we embark on so many things. For elderly ones, we have what we call elder support initiatives. We are, at certain age, we are bringing elder people on board in small quantity as we can afford. So that on a monthly basis, there are stipend for them.
MashaAllah.
It may not be more than 20,000. In some cases, even just 10,000 in rural area, where our people will visit them from time to time and give them necessary things that they need. We partner with healthcare practitioners who are volunteer workers that see this as a noble cause as well.
MashaAllah.
Just visit them, do all those little things like check their blood pressure, check their sugar level, and so on and so forth.
MashaAllah.
So when this is done, it has reduced to the PRS minimum.
Thank you very much. If you are just joining us, you have an opportunity to also contribute. Our telephone line is open. As usual, the number you can call is 0811-819-3603. I will call the number again, is 0811-819-3603. Èyí tí ẹ̀ ń wò wá àti èyí tí ẹ̀ ń gbọ́ wá nílé, ẹ̀yin náà lè darapọ̀ pẹ̀lú ohun tá à ń gbéyẹ̀wò ní òwúrọ̀ yìí náà ní àwọn ìgbìyànjú tí Zakat and Sadaqat Foundation tí wọ́n ń ṣe fún àwọn tí wọ́n bá ní ìpèníjà ìlera. Ẹ̀rọ tẹ́lẹ̀ pè sí láti fi bá wa dá sétò yìí, òun náà ni 0811-819-3603. Bákan náà, ẹ tún lè darapọ̀ pẹ̀lú wa lórí Facebook wa, Instagram wa, X àti YouTube. Tẹ́ bá ti wo Zakat and Sadaqat Foundation. Gẹ́gẹ́ bí àlàyé tẹ́ ti ṣe fún wa lédè Gẹ̀ẹ́sì, àwọn ni pé kí ni àsùntà vision yìí tí ẹ fi ń ṣe ìrànlọ́wọ́ fún àwọn tí wọ́n bá ní ìpèníjà ìlera yìí. Ẹ ti ṣàlàyé lédè Gẹ̀ẹ́sì, ẹ bá wa yànnàná lédè Yorùbá ní ṣókí.
Ohun tí à ń sọ ni pé lọ́dọ̀ wa nílé Zakat and Sadaqat Foundation, a ní ìgbàgbọ́ wípé ẹni tí ara ẹ̀ bá yá, onítọ̀ yẹn ọlọ́rọ̀ ni. A nígbàgbọ́ pé community, àwọn ìletò, àwọn àwùjọ tí ara wọn bá yá níbẹ̀ yẹn ọlọ́rọ̀ làwọn náà. Bẹ́ẹ̀ sì ni ìlú tó bá jẹ́ pé ọ̀pọ̀lọpọ̀ àwọn èèyàn tó wà ń bẹ̀ wọn kì í ṣaláìsàn, ọlọ́rọ̀ làwọn náà. Ló fi jẹ́ pé a fẹ́ràn pé ká rí pé ìlera ò ṣe èèyàn ò sick, òun ni first thing tá kọ́kọ́ máa ń ṣe. Ta prefer pé kí ara wa kó yá, gbogbo tó dẹ̀ lè mára yá là ń ṣe. Irú pé àwọn tó jágbàlagbà ń sìn, a ní àwọn òṣìṣẹ́ oníwòsàn tó jẹ́ pé wọ́n máa ń bá wa lọ rí wọn. Tó bá rí wọn, wọ́n á bá wa ṣe ìyẹ̀wò ara wọn, ìtọ́ni, àìlera, gbogbo kí ló ń ṣe wọ́n. So àwọn tí a bá lè tètè ṣe kó tó di pé ara yẹn á wá di pé sickness yẹn á wá pọ̀ sí, yẹn la máa ń ṣe. Kódà a tún máa ń gbé nǹkan tá à ń pè ní medical caravan, a máa ń gbé lọ sí àwọn ìletò. Bí o lè sọ pé tá a bá ní ká bẹ̀rẹ̀ sí ní kà, a ti ṣe ń tójú 200 lọ láwọn ìletò tá a ti lọ. Because ní bí àwọn bí state bíi 10 ló jẹ́ pé almost oṣooṣù ni. Oṣooṣù la gbọ́dọ̀ ṣe ọkàn oṣooṣù. Wọ́n á lọ síbẹ̀, wọ́n á lọ wòlú kí ni wọ́n á ṣe ìyẹ̀wò fún wọn, wọ́n á dẹ̀ fún wọn lóògùn, wọ́n á kó oògùn dání, wọ́n á dẹ̀ fún wọn lóògùn lọ́fẹ̀ẹ́. Nǹkan tí à ń ṣe.
Ẹ ṣeun gan. Bákan náà, I will want you to also shed light on how do you identify and also select the beneficiaries for your medical, health intervention.
The first one is our direct intervention when we go out for medical caravan, or when we see our people that go out to go and see the elder ones and they give us reports. So when this report comes, we will initiate our support for those people that are concerned. That's the first one. Alakoko ni pé we try as much as possible àwọn tí wọ́n lọ ń bá wa wo àwọn èèyàn tí wọ́n bá wá fún wa ní èsì pé nǹkan báyìí ń ṣe lágbájá báyìí àmọ́ pé lè ẹni tí ẹ ká ràn lọ́wọ́ ni. àwọn medical caravan tá a bá gbé lọ sí àwọn ìletò tí wọ́n bá ṣe àyẹ̀wò àwọn èèyàn wọ́n máa ń fún wa rìpọ́ọ̀tù tiwọn náà pé àwọn èèyàn báyìí ohun tó ń ṣe wọ́n rí. kódà wọ́n máa ń sọ fún wa nígbà míì pé ìletò yìí n tó ń bá wọn jà àrùn tó ní ṣe pẹ̀lú omi ni. tó bá ti jẹ́ pé àrùn tó lómi ni kò ń ṣe pé akàn wa sọ pé à ń kí ọ àrùn tó ní ṣe pẹ̀lú omi a máa lọ ń gbẹ́ kànga ìgbàlódé àlọ́gbẹ́ síbẹ̀ tó jẹ́ pé nísìn èyí tí ò nídìí pé a ṣe ń wá nepa àbá ń wá petrol là ń ṣe ń sìn. mo ṣe ń sọ̀rọ̀ lọ́wọ́lọ́wọ́ báyìí a ṣe parí méjì kan láìpẹ́ yìí a ṣe kan l'Edo State àtúnṣe kan ní ìlú Ìlọrin nítorí pé I believe pé tí a bá ti lè yọ challenges omi ẹ̀ kúrò ìrọ̀rùn á dé bá gbogbo àwọn aráàlú tẹ́ à ń sọ yìí.
ẹ ṣeun. In continuation, I also want you to share any specific success story of this, health intervention or medical intervention that you have done recently. Ẹ jẹ́ ká ẹ lè bá mú àpẹẹrẹ bí ẹyẹ kan àbí méjì wá nínú àwọn tí a ti ṣe ìrànlọ́wọ́ fún nípa ìpèníjà ìlera tó ṣe pé a lè tọ́ka sí pé ẹni báyìí bó ṣe rí tẹ́lẹ̀ rí o nígbà tá a dá sí ibi tọ́rọ̀ ẹ̀ padà já sí rèé.
mi ò ní fẹ́ dárúkọ èèyàn kan specific ṣùgbọ́n màá ṣàlàyé àwọn onítọ̀hún tó bá ń gbọ́ wá a máa gbọ́ ń sìn. alóbìnrin kan tó jẹ́ pé kò lè bímọ torí ìtàn ẹ̀ méjèèjì ńṣe ló ń lẹ̀ papọ̀ so kò sí bí èèyàn ṣe fẹ́ bá aláṣepọ̀ so Ọlọ́run dẹ̀ gbàdúrà fún wa pé a ṣe alákọ̀ọ́kọ́ a dẹ̀ tún ṣe ẹlẹ́ẹ̀kejì wọ́n pè ní hip replacement gbàtà dẹ̀ ṣe òun ṣe pé obìnrin yẹn pé ó lálàáfíà nìkan Ọlọ́run bá ṣe tó jẹ́ pé Ọlọ́run tún ní kó wá bímọ.
Allahu Akbar.
so ó wà nǹkan tẹ́ta bá rí inú wa máa ń dùn pé alhamdulilayi irú eléyìí nǹkan tó ṣe tọ́ka sí ni. ẹlẹ́ẹ̀kejì òun náà ní í ṣe pẹ̀lú àwọn tí wọ́n wá tó jẹ́ pé ọmọ láti kékeré ni wọ́n ti sọ pé kò ní lè gbọ́rọ̀ mọ́ táwọn òbí ẹ̀ ti gbà pé àwọn tí ò lè gbọ́rọ̀ kí ló wá fẹ́ wá ṣe ṣùgbọ́n pàtà tí wọ́n diagnose ẹ̀ wọ́n ló nídìí nǹkan tí wọ́n máa gbé sínú etí ẹ̀ tó jẹ́ pé tí wọ́n bá ti gbé sí á bẹ̀rẹ̀ sí ní gbọ́rọ̀.
Allahu Akbar.
àwọn òbí eré náà ń pè nígbà tó di pé àṣe ló kíní ẹ̀ náà ló tó pọ̀ díẹ̀ o ṣùgbọ́n nígbà tó yẹ pa àṣe tọmọdé bẹ̀rẹ̀ sí ní gbọ́rọ̀ akọ́ṣe ti alákọ̀ọ́kọ́ ó ń gbọ́rọ̀ àtúnwá ṣe ti ẹlẹ́ẹ̀kejì ọ̀rọ̀ yẹn wá clear ọmọ yẹn wà ń sùn bá ṣe ń sọ̀rọ̀ lọ́wọ́ yìí so eléyìí àwọn ọ̀dùnnú kan tó jẹ́ pé kọ́lọ̀ ọba kó bá san gbogbo àwọn tí wọ́n ràn wá lọ́wọ́ so ó ń dùn mọ́ wa pé àwọn kan tá a lè ṣe ni àwọn specific one nìyẹn. àwọn kan wà tó jẹ́ pé community ni ọ̀nà tí wọ́n yẹn ti ẹ̀ jìn ní Nasarawa State Adé hospital ọ̀nà yẹn ti jìn kí gọ́ọ̀mẹ̀ntì sọ pé lẹ́fẹ̀ẹ́ gbé mọ́tò lọ síbẹ̀ ẹ lọ almost 1 hour kẹ́ tó dé ibi tó hospital wà so ìrànlọ́wọ́ tá a ṣe fún wọn náà ni pé àkọ́kọ́ bá wọn ṣe kankan àgbàlódé àkọ́kọ́ gbé fún wọn hospital tí wọ́n ní kò ń ṣe hospital kankan tó ní nǹkan kan bí yàrá kan náà fi ń ṣe hospital a tún ṣe ìrànlọ́wọ́ fún àwọn náà so àwọn nǹkan tí à ń ṣe rè láti rí i pé gbogbo wa a wà ní ìlera tó pé.
Allahu Akbar. Kó tó di pé a máa dágbére fún ọ̀sẹ̀ yìí mo fẹ́ kẹ́ bá àwọn èèyàn wa sọ̀rọ̀ tí wọ́n ń wò wá nílé tó sì ń gbọ́ wa ọ̀nà wo ni wọ́n lè gbà fi dá sí àwọn ìgbìyànjú tẹ̀ ń ṣe yìí bóyá individual ni o àbí àwùjọ ni o àbí àwọn ilé iṣẹ́ ọ̀nà wo ni wọ́n lè gbà fi dọwọ́ pọ̀ pẹ̀lú ìgbìmọ̀ Zsf'S láti lè fi jẹ́ kí àwọn àǹfààní tá à ń ṣe kó tún gbé pẹ́ẹ́rí díẹ̀ sí.
First and foremost, I want to sincerely thank our donors. Many people have come forward to support this initiative that we are doing. so a dúpẹ́ lọ́wọ́ gbogbo àwọn tí wọ́n ń ṣèrànlọ́wọ́ yìí ṣùgbọ́n ká mọ̀ yìí pé ọ̀rọ̀ health ọ̀rọ̀ gbogbo wa ni o ọ̀rọ̀ gbogbo wa ni àkọ́kọ́ ni pé ká má sọ pé ìgbà tí n bá lówó tó bá pọ̀ kémi náà tó dá sí 100 naira ẹlòmíì ohun tó máa save kò ń ṣe nǹkan kékeré o ó ní 1000 naira ohun tó máa save kò ń ṣe nǹkan kékeré o tá bá wo bá ṣe pọ̀ tó ní orílẹ̀-èdè tí wọ́n bá tá bá fọwọ́sowọ́pọ̀ a máa ràn ìjọba lọ́wọ́ tó pọ̀ gan ẹ̀jẹ̀ wo ẹ̀wù population wá ń sìn tá bá ní ajẹ́ 1 million tá tẹ̀ fẹ́ bẹ̀rẹ̀ sí ní ṣe ìrànlọ́wọ́ yìí fún ara wa tó gbá wá 1000 naira 1 billion naira máa ti pé mà nìyẹn a ní 1 billion nìyẹn o so mo túmọ̀ wá pé gbogbo wa ẹ jẹ́ ká come together ká dìjọ fọwọ́sowọ́pọ̀ láti rí i pé a reduce ìlera tó ń ṣe ọ̀pọ̀lọpọ̀ nípa pé káà náà dá sí iléeṣẹ́ àwọn náà lè dá sí individual ó lè dá sí organization wọ́n lè dá sí torí pé a healthy nation is a wealthy nation.
Bẹ́ẹ̀ni, it is indeed a statement of fact that a healthy nation is a wealthy nation. A healthy person is a wealthy person. This is where we shall be drawing the curtain of today's edition of Path to Paradise. Until we come your way in our darling station at the same time between 9 to 9:30 a.m. I remain yours sincerely, Dr. Abdullah Shoaib, saying, Assalamu alaikum wa rahmatullahi wa barakatuhu.
Eyes for Allah, nothing but Allah. Ba is the beginning of Bismillah. Ta is for taqwa, bewaring of Allah. And Tha is for thawab, a reward. Ja is for Jannah, the garden of paradise. Ha is for Hajj, the blessed pilgrimage. Kha is for Khatem, the seal of the prophethood given to the Prophet Muhammad sallallahu alayhi wasallam. Da is for Deen, Al-Islam, religion with Allah since time began. That is for dhikr, remembering Allah, and rise for the month of Ramadan.